You have probably heard of Ultera or Ultherapy, but have you heard of Ultera PRIME? Let's explore what are the differences between Ultera and Ultera PRIME. So what is Ultherapy? Ultherapy uses ultrasound. We know pregnant ladies go to their obstetrician and they scan for babies. Those ultrasound be able to identify the layers of the skin. And in this case, Ultherapy, they uses what we call micro-focus ultrasound. That means they're able to focus the energy to the different layers of the skin. You can target the middle layer of the skin, you can target the deep dermis, or you can target a layer of muscles we call as mass muscles. It's a very thin layer of muscles that traditionally when the plastic surgeons trying to lift the face, surgical facelifting, they will pull these muscles. So when this energy being delivered to this layer, it stimulates collagen because we know heat stimulates collagen. And once you stimulate the collagen, you can tighten the skin. You can also lift the face. That's why it's used for the non-surgical facelifting. It's approved by US FDA for that. Does it cause pain?
Yeah, usually Ultherapy is quite painful. I think the patient need at least a numbing cream to numb the area that we are going to treat for at least 45 minutes. Then we'll start doing on the patient. The pain is reduced greatly with the numbing cream. Without numbing cream, I think the patient might have a little bit problem. But there's not much of downtime because most of the time after done, patient doesn't have any redness. The most also, they might have a little bit of strip of red erythema.
So recently, we have Ultherapy PRIME. So what is the difference between Ultherapy PRIME from the previous Ultherapy?
So Ultherapy PRIME is the newer generation of Ultera, with significant upgrades in terms of speed, comfort, and also the precision. So in terms of precision, the more advanced and high-resolution ultrasound imaging allows the practitioners to visualize clearly the skin layers and deliver the energies effectively at the area where it's intended to. So this will result in a more consistent, natural-looking, lifted look.
Yeah, because those days, we take a long time to do this procedure, right? But nowadays, in between the shots, they manage to shorten the interval between that. So with that also, it saves time, and at the same time, it's less painful for the patients because once the shots are being delivered fast, it's actually less painful for the patients. What are the indications that we can use Ultherapy?
Yeah, we can use Ultherapy to treat face and body. Face, we can actually lift the cheek area, we can treat the jowl area, we can treat the neck, double chin, and also around the eye, the periorbital area.
And also decolletage to reduce the fine lines and the creepy lines on the chest, and it can help to tighten abdomens and also upper arms.
Because some of our patients who have eye bags, those not too severe eye bags, we can still tighten the skin around the eye bags. Right? But it's not to remove the fat of the eye bags, but it's to tighten the skin. So then it helps to improve the eye bag condition of the patients.
Yeah, there are some limitations for Ultherapy because our target is actually the smash muscle. Area without the smash muscle actually is not very helpful.
But we know the smash muscles actually continue on from your forehead to your face to your neck. So that's why we encourage, even though patients is just concerned about the eyes sometimes, we encourage them to do the whole face because once you target the forehead, it also helps to lift up the eyebrows. It also helps to lift up the skin around the cheek and everything, which helps to improve the eye condition. So not just treating the eyes per se, but the surrounding neighbors are also important to improve the eyes. So what can patient expect on the day of the procedure?
So during the treatment, patient may experience some mild heat sensation or tingling sensation, which is tolerable. And there's no downtime, although some patients may experience temporary redness or swelling, which subsides quickly and which allows the patient to return to work immediately.
The collagen stimulation of Ultherapy takes about 3 months, so we always advise patients to wait for the result to kick in a little bit later. How long can the effect of Ultherapy last?
We always tell the patient that the effect actually lasts forever because there's no toxin that you inject, there's no fillers that you inject into it that will disappear. All these are stimulated by your own skin. But unfortunately, all of us will continue to age. Every year, we get more and more saggy, our skin. So we advise patients to come back once a year to repeat these procedures. We know Ultherapy is one of the most effective methods for face lifting, face tightening. With Ultherapy PRIME, it is even better. Less painful, faster procedure time, and better results. If you want to know more about Ultherapy PRIME, talk to your doctors about it.